everyone! In this video, my friends and I will share about infertility and pregnancy prevention. So, what is infertility? Infertility can be defined by not being able to achieve pregnancy or having babies after 1 year or more of unprotected sex. It can be divided into primary and secondary infertility. Primary infertility is considered as non-pregnancy has been achieved by a person. Meanwhile, secondary is at least one prior pregnancy has been achieved. Infertility is not an uncommon issue and can occur in both male and female due to various factors such as age, lifestyle, and problems in reproductive system. On contraception or birth control also has been addressed significantly as much as the infertility issue. In the early century, birth control is not accepted as it is considered as morally, religiously, and politically undesirable. However, effective and safe methods of birth control has lowered the rate of abortions and revolutionized women's lives, which make it openly accepted by the society.
So, talking about the infertility, you might be wondering, what actually can cause the infertility in men and women? Alright, for men, here are some reasons that might cause the infertility. For the first one, we have low sperm production. So, how to know that we have low sperm production? Well, if you have fewer than 15 million sperm per milliliter of sperm, then your sperm count is considered low. Next, we have abnormal sperm function. For this one, it could be either a chromosomeless, piece, head, or tail defect. Third ones, we have health problems. There are some diseases that might leading to infertility in men. For example, diabetes, as well as infections like chlamydia, gonorrhea, mumps, or HIV. Did you know? Research studies show that around 1 in 4 men with type 2 diabetes have low testosterone levels. So, low testosterone levels can lead to problems which can reduce fertility, such as low sperm count. The last factor of infertility in men is lifestyle. Smoking cigarettes and heavy use of alcohol would lead to infertility in men. Alright, let's continue with the infertility in women. So, what can actually cause the infertility in women? For the first one, we have problems with ovulation. Ovulation disorders meaning you ovulate infrequently or not at all. So, ovulation disorders account for infertility in about 1 in 4 infertile couples. Next, we have blockage in the fallopian tubes or uterus. Blocked fallopian tubes are a common cause of infertility. Supposedly, sperm and an egg meet in the fallopian tube for fertilization. However, since there is a blockage, a blocked fallopian tube will prevent them from joining. Third factor of infertility in women is age. A woman's peak reproduction years are between the late teens and the late 20s. By the age of 30, fertility starts to decline. This decline becomes more rapid once you reach your mid-30s. Next, we have lifestyle. Heavy use of alcohol and drugs will lead to the infertility. Last but not least, we have imbalanced hormone. Disorders like polycystic ovary syndrome and anovulation can be the result of a hormone imbalance in women. All this would lead to the infertility in women.
These are the treatments that used to overcome the infertility in male and female. Fertility drugs such as clomiphene citrate and metformin are used to stimulate ovulation in female. Meanwhile, hormone therapy is used to increase the production of sperm in male. Fertility also can be improved by performing surgeries, for instance, laparoscopic and tubal surgery in female, and vasectomy reversal and sperm retrieval in male. Reproductive assistance such as intrauterine insemination or in vitro fertilization is used to fertilize sperms and eggs.
Pregnancy prevention should really be taken into consideration, especially for women under the age of 20, as they are at higher risk of pregnancy-related high blood pressure. Same goes to women being pregnant after the age of 35, which makes certain complications more likely to happen. Women who struggles with weight and previous complications during deliveries too should take pregnancy prevention into account. Pregnancy prevention too can avoid sexually transmitted infections, STI, as well as multiple pregnancies in the future. Pregnant women under the age of 20 are most likely to deliver prematurely, with the baby being low in birth weight. Besides that, teenage mothers are at higher risk of getting mental health problems as they lack of support from family and community, which can lead to depression and making wrong decisions in life. Moreover, women who gave birth during teenage years were at increase of preterm and very preterm delivery due to a high blood pressure during pregnancy.
I will continue. Why must women above age of 35 must prevent pregnancy? First, the underlying conditions. Older women are most likely to have high blood pressure, diabetes, and cardiovascular disease. It could cause miscarriage, poor fetal growth, and birth defects. Next is the chromosomal problems. There are higher risks of having a child with birth defect, and syndrome Down are one of them. Several degrees of intellectual disability and physical abnormality would be occurs also.
Being pregnant with more than one baby is definitely exciting and is often a happy event for many couples. However, multiple pregnancy has increased risk for complications, and the most common ones are breech birth, depletion of essential nutrients for both mother and babies, as well as postpartum hemorrhage. Conceiving more than 2 babies will most likely to be delivered prematurely.
We move on to the next one, which is sexually transmitted infection, or STI. Women who have an STI are very likely to transmit it to their baby. Depending on the infection, a baby to a woman with STI has a higher risk of low birth weight, conjunctivitis, blindness, deafness, chronic liver disease, HIV, hepatitis B, hepatitis C, chlamydia, and gonorrhea. The mother will also experience a serious complication. For example, an untreated gonorrhea infection can increase the risk of miscarriage, low birth weight, or premature birth.
Pregnancy prevention can be done in 2 types of ways. If you prefer not getting pregnant without the use of any medications nor physical devices, then you can go for natural birth controls, which are mostly based on awareness and observations of a woman's body and menstrual cycle. Unless you're comfortable with using any devices, agents, drugs, sexual practices, or surgical procedures, then artificial birth control is the best choice, having 3 main methods to choose. Abstinence is one of the methods used to prevent pregnancy naturally by not having any sexual intercourse with your partner. Although this method is 100% effective and can prevent STI as well, it still can be quite challenging as it requires 100% commitment from both partners. Fertility awareness method is another natural method used to prevent pregnancy by identifying the fertile days of the menstrual cycle to observe fertility signs. But in order to maintain its effectiveness requires a continuous and conscious commitment with considerable monitoring self-control, as failure can occur when these manners are not taken seriously. The lactational amenorrhea method, also known as LAM, was created to allow women to safely rely on breastfeeding as a family planning method. Continuous breastfeeding can naturally stop ovulation. However, breastfeeding can only be used for the first 6 months of a baby's life. Thus, it may be less effective, especially once the baby begins to eat solid food. The calendar rhythm method works by monitoring a woman's menstrual cycle for a period of 6 months to establish how many days her cycle usually lasts. However, women with very short cycle is not suitable for this option as it may cause data fluctuation of the cycle. Cervical mucus is a fluid or a gel-like discharge from the cervix. Throughout a woman's menstrual cycle, the thickness and amount of cervical mucus changes. Thus, the cervical method can help women to predict ovulation and to help avoid or achieve pregnancy. Standard days method requires the least days of abstinence or barrier contraception. To successfully use this method, all you have to do is to avoid sexual intercourse from day 8 to day 19 of your cycle, which is a total of 12 days.
As my friend Cindy already shared to you the methods of natural pregnancy prevention, now I will share to you the artificial method to prevent pregnancy. First, there are condoms. Condoms are a barrier contraceptive made from latex rubber. It is 87% effective and best to protect against STIs. However, it can tear or come off during the sexual intercourse, and some people may be allergic to latex condom. Next, we have diaphragm. Contraceptive diaphragm is a circular dome made of thin, soft silicone that inserted into the vagina before sex. It is 83% effective and can be used more than one. It can last up to 2 years. However, again, it does not protect against STI. It may get moved out of place during sexual intercourse and also could cause urinary tract infection. We move to this one, surgical sterilization. For men, there are vasectomy method. It is a simple surgery done by a doctor. The small tubes in your scrotum that carry sperm are cut or blocked off, so sperm can't leave your body and cause pregnancy. It is 99% effective and a permanent way to prevent pregnancy. Though it does not protect against STI, it is complicated to reverse and fluid may build up in the testicle and cause chronic pain. For women, we have tubectomy. It is a surgical process that locks the fallopian tube, thereby preventing the egg release by the ovary from reaching the uterus. Again, it is 99% effective and does not affect hormone levels and also does not affect sexual intercourse. The cons of this method are does not protect against STI. It is complicated to reverse and fallopian tube may rejoin and make you fertile again.
So, to sum up all of this information, we need to be aware about the infertility and the pregnancy prevention issues among society, as both of these issues can bring complications to the human's body or to the baby. In terms of infertility, both male and female are equally affected. They can get affected from a disease or simply just by their unhealthy lifestyle, such as obesity, stress, and the excessive consumption of alcohol. However, infertility that is not linked to a disease can be treated by taking medications, undergoing surgical procedures, or through assisted conceptions, which is in vitro fertilization, or known as IVF. Besides that, pregnancy prevention is very important, especially for teenage girls. The Ministry of Health has already mentioned that the growing number of pregnant teenage girls under 19 is very concerning nowadays. So, why is it important to avoid teen pregnancy? The reasons are the same as what we have mentioned in this video earlier, which is that teens are at a high risk of getting preeclampsia, giving birth to a premature baby, and teen pregnancy can be fatal to the mother or the baby. So to avoid these complications of teen pregnancy, first of all, teenage girls must be clear about their sexual values and attitudes. Parents also play a huge role in avoiding teen pregnancy, such as supervising and monitoring their children's activity. So it is safe to say that all communities must be aware about these infertility and pregnancy prevention issues. That is all from our video. Thank you.